blindness include macular degeneration, glaucoma, diabetic retinopathy, and cataracts, and each of those have their own areas of vision loss, and so that can include spottiness, central vision loss, peripheral vision loss, or blurriness. And so we want to make sure that when we're working with a patient that's considered legally blind, that we ask them what they see and what they can't see. Can they see close up? Can they see far away? Can they see their meal tray or print to read? We want to make sure that we're not just assuming that it's lights out and they can't see, because they may have some remaining vision. So those are the main takeaway points, and I have a handout that goes with that. Secondly, we're going to go over if someone has a hip replacement. They have hip precautions, and so we're going to go over what those precautions are, which are you're not going to bend forward. You have a 90-degree angle, you're not going to bend forward beyond that 90 degrees. You're not going to cross your legs, and you're not going to roll your surgical leg inwards. So I always say, think of like not doing the twist.
Okay.
Those are the hip precautions that usually the doctor will put out in the precaution list on their orders. And then when we use those precautions for lower body dressing and we incorporate it into an activity, that's why we have to use the long handled equipment. And so you will see this equipment in their room. It could be scattered around or in a closet or under the bed, but we want to make sure they're using it. And so we have the devices so that they don't bend forward. We have that socket that we can use to put their foot in and slide it up on. We have the reacher so they can grab the waistband of the pants and bring it down to that surgical leg. And then when they get it to a point where they can reach it, they can pull it up. We have the long-handled sponge to get the leg. We get the long-handled shoe horn, obviously, to get the shoes on and off without bending forward, as well as the dressing stick. So it's got a hook on that so they can push their socks off over the heel. So that's part of the lower body dressing that OT covers and that they should be carrying through in their room. And then we'll go through with...
So the biggest thing for hip precautions with therapy is getting in and out of the bed or transfers. So when we're getting up, this is where you would be concerned with that crossing or rolling. So you can either put a pillow between the legs or kind of move the legs and then the trunk. So Patty, I'm gonna help you keep this leg kind of in the middle. I want you to bring that hand across. We can grab the rail. And then just kind of scooch this way, helping keep that leg kind of in that neutral position. And then when we go for transfers, not breaking that 90 degrees, right? So if we're already sitting here, we really can't lean forward much more. So get our gate belt here. Thank you, ma'am. Snug in case they need help. The other thing to consider is this bed's already raised a little. So we can always raise it a little higher so we're not bent more, right? And then we want to be aware of what surface we're transferring to, because if it's a really low chair, then we're going to break that 90 degrees. So you can bend your leg a little bit. There we go. All right, we're going to stand up. I want you to push up with your hands from here. And up we go. Good. Grab the walker. Okay, good. And we're going to turn. Back up to the chair. Good. Now reach back. You can kind of kick that right leg out a little bit and go ahead and sit. So that way, when we go to sit, we're not crouching and bending, right? We kick that leg out, kind of maintain that motion. Okay, perfect.
And then for the next one we're going to cover is sternal precautions for cardiac patient. So if they come with a cabbage, a cardiac bypass graft, we want to make sure that they are following their precautions. They're called sternal precautions. We have a printed out sheet that should be covered and it should be posted above the bed in the room, just like the hip precautions should be posted as well. And that the main ones that we want to pay attention to are not lifting more than 8 pounds. We usually just say a gallon of milk as a good reminder. Don't push or pull with your arms, meaning you can't push up from the bed, you can't push up from that wheelchair, which is difficult for the patients. You don't want to raise your arm above 90 degrees, so nowhere in here, which is going to tax the heart. You don't want to reach behind your back, so no tucking your shirt in or reaching behind you. And you want to brace your chest, so you want to cover that, and that's what Stephanie will cover in a little bit. As far as occupational therapy goes, we enforce or encourage what we call energy conservation and work simplification tasks. So we call it the 4 Ps, which is to prioritize the tasks that you have to do, plan them out so that you don't make extra trips and you don't worry, use up that energy that you have for the day. Pace yourself. So we really want to make sure that their breathing is normal and they're not overexerting themselves. And that's where we check their oxygen level, we check their blood pressure, we check the vitals. And then positioning yourself, trying to keep yourself in a comfortable position where you don't strain your muscles and you don't tax yourself. And so to do those things, we can easily use the long-handled equipment again. We can check their vitals, we can make sure that we're counting out the steps to do and we're planning ahead, and we work with that patient on trying to organize those 4 Ps so that it makes sense to them in their everyday living activities.
So just to kind of go off of what Patty said with the sternal precautions, a lot of the patients after the cabbage will come with the heart hugger. Okay, it kind of looks like a vest. We want to make sure that it fits so we don't have to do some adjusting, but it's going to go over both arms like so. And then the back waist portion does adjust. It's got Velcro, as do the shoulder pieces. Ideally, we are going to be hitting right over the chest, because these 2 handles will show they can give themselves a little tug. So if they feel like they're gonna sneeze or cough, you can pull that. And also, it gives them a place to hold on to, right?
Yeah.
If we can't push pull to transfer, often I will just say, give it a little tug and we'll stand up. So let me show where we can adjust the back. So we've got Velcro, and then we can just snug it on both sides. I'm just gonna do one for the sake of time. But same thing, we're gonna get the gait belt typically low, so we have that sternal incision. As long as they're not gonna bear through the walker, perfectly fine to use it for the transfer. So for this, typically we raise the bed up so they're not sitting too low, right? We can't push or pull. So we kind of just have to use a little bit of momentum. We're gonna go up together on 3, 1, 2, 3, and big push up. And then she can reach and grab the walker. We can turn to have a seat. Slow. Now here we can't reach back, right? So go ahead and give yourself a little hug with that hugger. I'm gonna help you bend slowly and sit. Perfect.
So the patient, if they doing that by themselves, when they sit down, they flop. I've noticed them do that. Like,
Yes. So that's why you want to be in a good position to help them lower, and that's one of the things we're kind of working on, that control with the legs. To compensate, raise the surface that they're sitting on. So if we choose like a higher recliner, usually the wheelchair or like the bedside commodes are usually the lower things because the bed can raise. Typically the recliner's high enough, but you can always talk to us for therapy and we can kind of help figure out, modify the room setup for that.
And we're always happy to help, and if you want us to work with you with a patient, on the ward and show you some tips or techniques, we're glad to do that. And we have plenty of informational resources for you, so we're here to help. We'd love for them to carry it over in the room. It's just going to benefit them more and hopefully get them home sooner. You guys have